Here are some USMLE-style questions on autoantibodies to postsynaptic nicotinic ACH receptors, which is associated with myasthenia gravis. Question 1. A 32-year-old woman presents with complaints of intermittent double vision and difficulty swallowing for the past 3 months. She reports that her symptoms worsen as the day progresses and improve with rest. Physical examination reveals bilateral ptosis and fatigable muscle weakness. A bedside ice pack test is performed, and the patient's ptosis temporarily improves. Which of the following is the most likely underlying pathophysiology? A. Autoantibodies against voltage-gated calcium channels. B. Autoantibodies against postsynaptic nicotinic acetylcholine receptors. C. Demyelination of the central nervous system. D. Destruction of anterior horn cells. E. Deficiency of choline acetyltransferase. Answer: B. Autoantibodies against postsynaptic nicotinic acetylcholine receptors. This is myasthenia gravis, MG, caused by autoantibodies targeting the nicotinic ACH receptors at the neuromuscular junction. Symptoms worsen with activity, fatigue pattern, and improve with rest. The ice pack test is used to diagnose MG. Cooling improves neuromuscular transmission. Question 2. A 45-year-old man is diagnosed with myasthenia gravis after presenting with progressive weakness and fatigability. Chest imaging is performed and reveals an anterior mediastinal mass. Which of the following is the most likely underlying condition associated with this finding? A. Lambert-Eaton myasthenic syndrome. B. Small cell lung cancer. C. Thymoma. D. Multiple sclerosis. E. Amyotrophic lateral sclerosis. Answer: C. Thymoma. Myasthenia gravis, MG, is commonly associated with thymoma or thymic hyperplasia. The thymus plays a role in the production of autoreactive T cells, leading to autoantibody formation. Lambert-Eaton myasthenic syndrome, answer A, is associated with small cell lung cancer, not thymoma. Question 3. A patient with suspected myasthenia gravis undergoes repetitive nerve stimulation testing. Which of the following findings is most likely in this patient? A. Incremental response in compound muscle action potential, CMAP. B. Decremental response in compound muscle action potential, CMAP. C. Prolonged latency in motor evoked potentials. D. Conduction block in sensory nerves. E. Fibrillations on electromyography. Answer: B. Decremental response in compound muscle action potential. In MG, repetitive nerve stimulation shows a progressive decline in CMAP amplitude due to impaired neuromuscular transmission. Lambert-Eaton myasthenic syndrome, LEMS, shows an incremental response, answer A, with repetitive stimulation. Question 4. A 50-year-old woman with myasthenia gravis is undergoing surgery and receives succinylcholine for rapid sequence intubation. The anesthesiologist notes prolonged muscle paralysis. Which of the following best explains this phenomenon? A. Upregulation of nicotinic acetylcholine receptors. B. Downregulation of nicotinic acetylcholine receptors. C. Increased acetylcholine degradation. D. Reduced sensitivity of presynaptic calcium channels. E. Increased expression of voltage-gated sodium channels. Answer A. Upregulation of nicotinic acetylcholine receptors. In myasthenia gravis, chronic receptor blockade leads to compensatory upregulation of ACH receptors. Succinylcholine, a depolarizing neuromuscular blocker, causes prolonged depolarization and paralysis due to the increased number of receptors. Non-depolarizing agents, e.g. rocuronium, are more sensitive in MG patients. Let me know if you want more questions or a specific topic within neuromuscular disorders.